Welcome back, listeners, to another episode of Ultimate Potential, a mental health podcast. I'm Tony.
And I'm Craig.
And we are here to discuss all things mental health. We're excited. We have some very prestigious and specialized and long-term experts in the field here with us on our podcast today. We have Dr. Michael Gass and we have Craig Dobkin, who will be speaking with us as well. In just a moment, we'll have our two guests tell us a little more about themselves. But before they do, let's just start with that.
Sure. My name is Dr. Michael Gass, and I am the Executive Director of Research and Funding for an initiative that I'm working on with Craig Dobkin, who's on this call. And then besides that, I have spent the past 43 years at the University of New Hampshire working on the use of adventure as a means of creating benefits of mental health. And I have a long time association with NATSAP and the Outdoor Behavioral Health Care Center and other tasks there. And I'll stop there and we can go on from there if we need to.
Dr. Gass, can you tell our audience what NATSAP is?
NATSAP is the National Association for Therapeutic Schools and Programs, and it's an initiative that was begun by a lot of great people trying to bring about the betterment of how we work with youth in special places, such as the wilderness or residential treatment centers or therapeutic boarding schools. And it started as an organic movement of like-minded people together, and then it has turned into a professional-based operation where things such as accreditation, research, professional administration, all of those practices together are working together to make the world a better place.
Craig Dobkin, would you mind telling us a little bit about yourself?
Well, my name is, as already said, Craig Dobkin. I'm a lifelong learner. I got on this podcast because my good friend, Dr. Michael Gass, co-founder of Play for Peace, where we believe that live well, choose compassion, and practice peace. So we try to work with children 5 to 12 years old and trying to teach them how to be peacemakers in their communities and to do acts of courage and just really show up every day and trying to make a difference into their communities. Our big thing is to do constantly working with cooperative play as a way to move forward with the process. So that's it. Taught school, many different places, and I look forward to the podcast.
Okay, very good. Thank you so much. And thank you both for being here with us. So just to introduce the topic, so we have parents who are considering an out-of-home placement for their child who listen to our podcast. We have referral sources. We have professionals who work with youth who listen to our podcast. And they're all consumers of information, consumers of media like we all are. And what they may have stumbled across are media stories in the news of students being harmed in a program, a therapeutic program, or perhaps a death that has happened in a wilderness program or an outdoor behavioral health program. These stories pop up from time to time in the media, and they're very alarming when it happens. Additionally, there's some Netflix documentaries. I think there's a documentary on HBO Max that are very damning and very critical of out-of-home placement for youth. Additionally, there's a movement led by Paris Hilton, who she herself was a teenager who was in treatment back in the 1990s. And she had a bad experience. And so as an adult, she's come back and said, hey, I was at a place where bad things happened. It wasn't helpful to me. I feel like this is not the type of place that young people should be. And so she started a movement that I would say is an attempt to hold treatment programs accountable, make their quality higher. And if you're a treatment program that doesn't have good controls and doesn't have a track record of success and safety, then she wants to shut that down. So the reason this is an important topic is because we have, these young people who are now adults who were in treatment back in the 1980s and 90s and who had some bad experiences, and are really trying to really, in some cases, just shut down the entire mental health industry, right? Especially for out of home placements. What I think they're not considering, some of them are not considering, is that treatment since the 1980s and 90s has evolved. And as we've done away with practices that I think some in the past may take issue with, I don't know that the criticism of out of home placement has kept up with that. So the concern is that we have families that need help, we have teenagers that need help, and because of their fears of what they're seeing in the media, because of their fears that are stirred up by these movements, anti treatment movements, they're not seeking the help that their children need. And I have a personal opinion, and this is just me speaking. Um, I think that there's much more harm being done by families that have taken themselves out of the market of seeking services. I think that more children are dying because they're not getting services than any harm that is happening in therapeutic schools and programs. So it brings us to this really important question, and it brings us to why we have these two distinguished guests with us, one of which is a long-term researcher. It brings up the question of, is this safe? Are therapeutic schools and programs safe? And do they work? Those two questions, I think, are the most paramount of questions and should be on front of mind for any parent who's seeking an out-of-home placement for their child. So with that long introduction, I'd like to just ask our guests, why should people care about research regarding mental health treatment in general, or outdoor behavioral treatment and residential treatment centers specifically?
Well, I'll start on that one. I think there is a number of questions supporting that first question of, is it safe? And that builds up the program of whether or not these are valid treatments in the treatment of youth, generally speaking 13 to 17, but certainly there's adult programs too. And that's when research comes into play into this dialogue, because you have people asking, is it safe? Is my child going to be safe if I go on this program? And it's not a yes or no answer. It's basically a foundation of a number of studies that we've been working on together, and we've started in basically the early 2000s with Keith Russell, starting looking at safety of programs. And what we did is we compared programs in wilderness settings to programs that were also contributed, well, programs that also began in their program together. So what is that we looked at recreation programs, we looked at other educational settings programs, and we compared safety records. And comparatively speaking, is that your child is safer on the programs that are out of placement than, generally speaking, if they just stayed at home. And the safety is can be seen in the statistics that we work on together. Other things that support that, is it safe, is that another one is, does it work? And we looked at a number of things on saying the programs that we have for outdoor behavioral health care programs, residential treatment centers, and therapeutic boarding schools, is that how many actually go into wilderness or other programs and start at a clinical level, which means is that if they enter a clinical level, that means is that they're doing dysfunctional behavior that sets them apart from a normal range. So, for example, in outdoor programs, 70% of the children that go into the programs start in a clinical statement, and by being involved in a program, move to a normal range or normal behavior. And 25% of the youth that enter into clinical and don't achieve clinical change, the number's at 25%. And then actually, when children turn in and become worse in clinical behavior, that's 5%. So generally speaking, in outdoor behavioral healthcare programs, 70% of the children will come out with better behavioral scores than the other 30%. And of that 30%, 25% will stay at a clinical level, which means they still need additional services, and 5% will become worse. In residential treatment centers, we start off with 73% that enter the program score at a clinical level. And then 5% will stay at a clinical level, and then 5% will basically become worse with treatment. And then with therapeutic boarding schools, we're at 75% again, with starting at clinical levels, moving towards normal range behavior. 17% stay the same, and then 8% will become worse. So keeping track of how adolescents progress through these treatment centers keeps us knowledgeable of how we're involved in the treatment and how successful we have and what parents can honestly expect from these programs here.
No, that's just really interesting because I just kind of threw out my own personal hypothesis that children were less safe in their caregivers not seeking treatment than they were in enrolling in an out-of-home placement. You know, if they reach that level of clinical acuity that they need the help. And what you're saying is that the research has actually justified or validified that.
And it's an evolving practice and series of practices, and that extends to like questions of like how much change can we expect our adolescents to have, and then on top of that, what does the field present to parents as far as guidance to help their child be safe and get better. And one of the things are the growth of the accreditation programs that have happened since 2010, and the Association for Experiential Education has been a third party that has entered into the formula to keep its objectivity and guidance in what practice, and that has helped a great deal with those programs and the deaths that have happened in those programs. We also look at, is it worth the cost? And there's a number of expensive programs that exist, and say, is it worth the cost? And what we've been able to find is that by entering the programs, the cost of treatment will actually pay off itself over time with the changes that the client's experiences, because they don't invoke all of the expenses that it costs to continue to try and treat children, and it doesn't work, and you still have to pay for treatment for what they're doing. So that's something that we did through a program called the Golden Thread.
That's pretty cool research. Dr. Gass, you, as you know, over the years, and we've worked closely together for 3 decades or so, and your research has been so valuable to those of us who are passionate every day about saving lives and helping kids heal. A lot of times on our podcast, we ask questions that we already know the answer to. We just want to ask the good questions so that our listeners can understand. I'm going to ask you a question that I don't know the answer to, hoping that you might have one, but it's related to research. And the reason why it's a question and I don't know the answer is because our media nowadays, right? Like it is, it's clickbait sometimes. It's, you know, people get their raises and keep their jobs in the media if they write stories that are, you know, things that people want to read, or dramatic things or shock factor things. And so, you know, when I'm just in my local community and I hear about the, you know, how many kids in the junior high died by suicide, how many of the young teenage girls are sexually assaulted by the time they're 18, how many people get abused in their home. I just heard this morning the reports on the Department of Human Services, like how many abuse claims, in-home abuse claims that are in our state, in our home state, happen per year, right? Like how many did they get in the last 12 months? It's like outrageously high. So whether you're in a church, or whether you're in a youth activity, or whether you're on a sports team in a high school, the hazing, you know, the bullying, the whatever, like part of me thinks, because I know how safe our kids are. Like, it's not perfect, right? You can't always screen for every single safety thing, but I know that I had 5 children that went through the public school system, and many times I felt like I would much prefer them to be in my private treatment center school than I would in the public school because it just felt so much safer. Is there any research, not just about diagnosed things or treatment things or cost things, but is there any research just in general compared to the normal public, even if you're not struggling with some kind of a diagnostic situation? It just seems like that they are safe places, comparable to almost anything that you can do as a child.
Yes, the big three factors that we're looking at with adolescents right now, and we've been demonstrating huge damage in these areas, are depression, anxiety, and substance use disorders. And those are the three markers that we track over time. And in all three areas, the amount of adolescents, or the number of adolescents that encounter these three difficulties, and a lot of times they encounter all three, has never been higher. And so depression, anxiety, and the use of substances that go along with that are what we are experiencing at the greatest rates our society has ever had.
So it's surrounding our kids inside and outside of treatment, at all in all corners. Yeah.
I was going to say, on a slightly different topic, if it's okay to move on, going back to something you said, Dr. Gass, about the cost of treatment paying off over time. That's really interesting. I actually didn't know that you had done research looking at the cost benefit analysis. And a metaphor that comes to mind is say that you have the opportunity to invest in some kind of an exercise program, but it costs $5,000. So you're saying that the research has shown with mental health, say that this $5,000 exercise program, you knew that if you didn't invest in the exercise program and as a result become healthier, it may cost $15,000 or $20,000 over the next 5 years in medical issues, right? To deal with the effects of not having, invested in that exercise program. You're saying that with mental health, when it comes to outdoor behavioral health, out of home placements, the cost can be significant, but over time, it actually saves money in the big picture. It saves society tax dollars and treatment dollars over the lifespan of an individual.
Right. This was a article that we looked at. We're looking at. It first started off with Stephen Oss from University of Washington did a great study that opened up the discussion on whether evidence-based and cost-benefit analyses actually can prove these types of things. And he looked at actually the typical new cost to build a prison and operate a prison, and it was in the pricing of $310 million a year to operate and to begin those. And so that opened up the idea to look at how do we reduce the future need for prisoner beds, save money for state and local taxes, and reduce crime rates. And with those, that's spurred our interest. So we looked at youth that went on programs, youth that didn't go on the programs, and then youth that found themselves not belonging to either ones, and actually deaths that occurred because of their failure to be in these programs. And we ended up finding that it doesn't take long for comparing the cost that is saved on society by treating youth in these programs versus not treating them. Over time, it just bankrupts our society by having to go through so many programs and not being successful, or to not have any programs.
Tell us a little bit about what progress has been made regarding research within NATSAP. I know you've played a pivotal role within the National Association of Therapeutic Schools and Programs in helping them kind of coordinate their research efforts as a group of programs. What progress has been made, and where do you think our profession should go from here in terms of research?
Well, the progress has shown that the three basic programs that are housed within NATSAP, the therapeutic boarding schools, residential treatment centers, and OBH programs, is that given a length of time, all three programs will produce functional change for youth in intake to post-discharge. The failure that we have as a program is that we are not done a good job and it was good to hear that Telos is starting to approach this, is that when they leave treatment and then the follow-up or post-treatment scores. We haven't done a good enough job to do that. But in looking at just treatment itself, all three of the programs, given enough time, will produce changes in clinical ranges in the youth that are there statistically.
So you're saying the good news is from admit to a program to the day of discharge, clearly the research shows that young people are getting better in these programs. But when we are track them 1 year after discharge or 6 months after discharge or whenever that may be, we don't have enough data yet. We haven't done a good enough job in collecting that data. Well, the good news is at Telos we've done that and we've been successful and it does work. At least it works at Telos, and I would be pretty confident in generalizing that to the rest of the industry. Of course, that's what research is all about, though. You can't just take one study at one place and generalize it everywhere. You have to duplicate it over and over and over again. So, looks like we still have some work to do.
Research is something that it needs to be worked on over time, and it, generally speaking, in the beginning of its process, produces more questions than it does answers. And it's difficult, but there needs to be a patience on the part of the field, and also sustainability of research programs that will help them maintain their focus on change and what needs to be done to create the change, the benefits that will happen because of these changes.
I've been following your research, like I said, for a long time, and so much of it has been directed toward those who have clinical diagnoses that are under the care of professionals, and that's all been appreciated. And of course, it helps us know that what we're doing works, and it helps the public understand and have confidence in our work. But this new thing you've got going, the play for peace, in my mind, since I don't know anything about it, like there's the inner peace, like the yogi, and then there's the peace within families, peace within a local sports team or a classroom. There's in our society, there just seems to be so much division, whether it's political or racial or whatever it is. And then there's like world peace. There's conflicts going on all over the world. We hear about them in the news only if they're connected to our political interests sometimes, right? Like we hear about Israel and Gaza all the time, but we don't always hear about what's going on in Africa or Indonesia. Sometimes much worse atrocities, but not connected to our political system, right? So what is it exactly that the two of you are doing, and is it connected at all to clinical diagnostic work, or is it more just worldwide stuff? Can you tell us a little bit more on the details of what this project is? And then we're going to give you a chance, we'll post everything, connections, so that people who are interested in that can get in contact with you or donate or get involved or whatever. So time's yours to answer those questions. What is Play for Peace? And I think it's play, Play, right? Not pray.
Play for Peace brings together children, youth, and organizations from communities in conflict using cooperative play to create laughter, compassion, and peace. Working in over 24 countries around the world, Play for Peace is excited to expand our community. And that's something that we're really doing quite a bit, especially in the United States. We're basically an international organization, but we're now starting to build more in the United States. Los Angeles, Wisconsin, Chicago, Denver are the places we now are. The Play for Peace, we have a 9-theme curriculum divided into 3 modules. And those modules are Live Laughter, Choose Compassion, and Practice Peace. And within each of these modules includes themes, objectives, skills, and activities that can be spread out over a calendar year.
Dr. Gass, that is a beautiful vision. Um, I love how it goes through all of the different reasons of why we play. So, Craig and I, of course, have been running therapeutic programs for a few decades now together, and a really important part of what the young people do in our care to get better is play. It's there's a whole type of therapy called recreation therapy, and you know, when you're working with young people, sitting and talking about old wounds, sitting and talking about new skills, it only goes so far. And at some point, especially if you're a young person, it's so powerful to be able to stand up and to move and to do something that's fun and entertaining and feels like play. I mean, legitimately is play. And yet the therapy is happening in the background. You know, the therapy is happening in many times as a client, you don't even know it. Yet at the end of it, something powerful has happened and you emerge from that changed. So what you're doing, if I'm, seeing this correctly, is you're taking the power of play, the therapeutic value of play, and you're taking it all around the world to populations that are deeply traumatized, or have lived in fear and have seen a lot of violence.
Right. I see it as compassionate play, where the concept of compassion, which is one of the greatest attributes any person can have, is a great starting point. And we believe that this entrance into the family system or the community system of any individual, by lifting them up through this idea of cooperation and expanding that through other elements of their system, will bring about the type of change that we really long for as a world, what we're trying to do. And I've written one research article so far on that, and we found that children provide such a great avenue for us when they're trained for community service and cooperative play and form kind of a Play for Peace club. And we have 16 programs across over 60 communities around the globe. We have these curriculums in this place. I've been fortunate enough to travel to many of the places we go, probably most often Guatemala, and provide facilitation that they take and incorporate into their society that brings about sustained growth in local leadership, empowered youth, and regional organizations that bring about cooperation, inclusion, caring, and community members.
What a beautiful, beautiful vision and a beautiful mission. Where would our listeners go if they wanted to learn more about Play for Peace?
You can go online and see playforpeace.org.
Okay.
And we're into our 25th year of Play for Peace. And so we're having that celebration for being along that. And just if people want to donate, you can go online, but it's right on the homepage, first line, and it will be happy to come there, creating a world of compassionate play.
Well, thank you for
And
sharing
if you
that.
want,
Oh, go ahead.
and if you want to become a fundraiser yourself, we'll help train you.
There we go. So people can actually reach out to you and if they want to help with actual fundraising money from other organizations and such, that you will help them. You'll train them.
Yeah, and there is great stories of how this kind of change has created a world of compassion,
Wow.
which is a great gift.
Well, Dr. Gass, thank you so much for spending time with us. We really appreciate your time. We appreciate your entire career and what you've done in the service of, in the name of helping young people. And what I learned now is that you've been doing 25 years of this Play for Peace organization too, which is absolutely amazing and inspiring. And so thank you for being who you are. Thank you for joining us on this short podcast today. And we want to, we'll extend our gratitude to Craig Dobkin also. And so from our Mental Health Matters podcast, we just want to go ahead and wish everybody well, and always remember that mental health matters.
Thanks for listening. Your mental health journey is so important to us. We'd love your help spreading the word so we can reach as many people as possible. Don't forget to share, like, and subscribe here on our social media or wherever you access your podcasts. Thanks.